Emergency responders have been trained to decontaminate victims of a terrorist attack. However, large numbers of contaminated victims will make their way to the hospital without having been decontaminated, or with inadequate decontamination. If the hospital is not prepared, injury to staff and contamination of the emergency department or the entire facility may result. Hospital staff must be able to recognize potentially contaminated patients, protect themselves and the facility, and mobilize the proper response. In fact, the Joint Commission on Accreditation of Healthcare Organizations' Environment of Care standard requires that hospitals have means for radioactive, biological, and chemical isolation and decontamination. Many hospitals have permanent decontamination rooms that can manage 1 or 2 contaminated patients, but not the large number that may be involved at a mass casualty incident. Some hospitals have established agreements with fire departments to respond to the facility in the event mass decontamination operations are required. However, in many of these situations, all area fire units may be committed at the scene. Hospitals should have the ability to quickly mobilize a hospital decontamination team with necessary personal protective equipment and a mass casualty decontamination system. This program is the 4th part of a series called Hospital First Receiver, designed to provide the information required to manage patients who may pose a secondary contamination risk, and is called Patient Decontamination. The program will explain the importance of patient decontamination and show how the procedure is carried out. Patient decontamination techniques will be highlighted, as will the safety procedures necessary to protect first receivers who must carry out these tasks. The program will show ambulatory as well as non-ambulatory decon procedures, discuss decontamination for the decon team itself, and describe termination procedures after the event is over.